And with this walk across the stage, Zachary Miller leads the way for Canadian-trained public health leaders.
How do we make a better, not just public health system in general, but public health, the practice of it, how do we make that better for Canadians, First Nations people, Indigenous people, etc.
Up until recently, public health workers and leaders had to leave the country to study in this field.
The original schools that developed the program were Johns Hopkins and Harvard and the London School of Hygiene and Tropical Medicine. They were really at the forefront, but now the degree is offered in some 40 universities, particularly in the United States.
But now they can study at home. This past fall, Dr. Miller became the first person in Canada to defend his dissertation and earn his doctorate, opening the door to a new era of public health professionals to work and care for Canadians, who, unlike doctors who provide direct care of patients, concern themselves with the systems needed to care for populations.
How do we make the population as a whole healthy rather than just individuals? And that comes down to systems and education, health education, etc. And health promotion.
Dr. Miller is also leading the way in bringing public health to his community of Six Nations of the Grand River, with an understanding of the unique public health issues that Indigenous communities face.
My sort of drive within this field is trying to find ways to learn from those who came before us, and what lessons can they teach us from history, be able to pull that into the current context and into the future so that we can better respond to these events when they happen.
Students are required to have a master's degree, usually in health sciences, and 5 years of professional experience before they enter the doctorate program.
One of the big distinctions of our program is that when the students finish their work, they're able to take that work right into the workforce, right into the society, right into improving public health.
The next round of applications are being reviewed, and the next cohort will begin in the fall. For City News, I'm Beverly Andrews in Toronto.